Dr. Peters from Hidden Lake Dental Group, and this is my office manager.
Hi, I'm Allison Potts.
And so we had a patient reach out to us who has been really kind of in the middle of the COVID scenario. She's medically compromised. She has a heart condition, and her cardiologist has basically told her that she is not allowed to leave the house. She hasn't been to any parks. She hasn't been to any grocery stores. And she likely will not be allowed to leave the house until a vaccine has been delivered and developed. So she was really, really hesitant to reach out to contact our office when her night guard cracked, and she knows that she has a history of clenching and grinding, and was really, really concerned that she was going to start breaking teeth without a night guard. Her cardiologist, I mean, truly does not want her to have any sort of interaction with anyone who may be contagious or carrying the virus. So she was immediately brought back into the room. We asked her which type of night guard she would like, top or bottom. She said top. She was the only patient in the office at that time, which made her feel a lot more comfortable. And then we took impressions. I mean, she was probably there for roughly about 10 minutes, and then was able to leave. And then on the way out, we talked about the delivery of the night guard, and she was our first patient that morning. And she was the only patient in the office, which again made her very, very comfortable. So it says, Dear Hidden Lake Dental Group, I haven't left my house in almost 7 weeks now. My cardiologist deemed my heart condition as high risk and threw me into isolation early. I haven't seen the grocery stores or been to a park. I only hear the stories. I won't be allowed to rejoin society until a vaccine is in distribution. So I have a very long time inside my room still left to go. All that to say, as someone who could easily die from COVID-19, I really, really appreciate all of the kindness, instruction, and effort on your end to keep a healthy place of business. I was so nervous to call because I didn't want to come in, so thank you for taking it seriously for all of us that need you to. I'll be sure to come see you next year when I can.
So she called one afternoon. She shared all this information with me, and her biggest concern is what we were doing at the office to protect her. And so I just went through our normal protocol. We had the front door propped open, so no one had to, touch it going in or out. The entire team and any patients coming into the office were wearing masks. At check-in, we would take temperatures of the patients and do a questionnaire and see if they have traveled or any COVID symptoms. And then went over just how we were disinfecting the entire office daily in between patients, in the back as always. And that we also were checking temperatures of our teammates just to make sure everybody in the team wasn't showing any symptoms of COVID.